Hello, welcome again. Dr. Anthony Gonzalez here with Miami Community Health. We welcome you here for another important health topic, and I've brought a friend and an important individual to talk to us about a topic that is hot now. Something that's a little different than what we've been listening to and different than what you've heard on this show before. We're going to talk a little bit about the brain and psychology and our mind and how it works. And we're going to talk about how it's related to COVID. Yes, COVID and how COVID can affect your brain. So first, before we start, let me introduce to you our guest today. Our guest today is Dr. Rafael Rivas-Vazquez. Welcome.
Pleasure to be here.
All righty. So first, tell our guest a little bit about yourself.
So I'm a neuropsychologist on staff at Baptist Hospital. Neuropsychology is the subspecialty within psychology that puts the brain and behavior together. So anything that can take place to the brain that's going to impact the way you're thinking, the way you're acting, the way you're feeling is under the purview of neuropsychology. So that's the branch. So the things that I see are anything from, Alzheimer's disease, traumatic brain injury, multiple sclerosis, Parkinson's. And now as of late, we're seeing a lot of people who have had COVID and are presenting with neuropsychological complaints.
Wow. And that's tough. I as a surgeon, I'm more physical and I have to be able to see what the pathology is. You're in the brain trying to determine these behaviors that people are having and where it lies in the brain and what's happening in the brain. So that's kind of hard to envision.
Correct. So a lot of it is subjective and based on the complaints that folks come in. It's tough to measure, and it's certainly tough to measure objectively. And what we're seeing in the office with patients who have had COVID are based on our assessment, our clinical assessment, running labs on these folks. And we've come to identify this very interesting and sometimes very troubling and debilitating syndrome that has come to be called long COVID, and folks who have it are called long haulers.
Wow. Long hauler. A long hauler was something else. Wasn't that like a truck that goes down?
Because the first gal who coined the term was wearing a trucker's cap when she went to get tested, and she pretty much became the champion for the long haulers.
Wow.
And it's symptoms that are persisting after you've had COVID.
So we've heard a lot about COVID. We've talked about COVID here. I try not to cover a lot of COVID anymore because people are exhausted of hearing about COVID. But when you told me about this topic, and I had no idea as a surgeon, I had no idea about this because I don't hear about this in my day-to-day, you told me about it. So let's talk about long COVID. What is long COVID?
Yeah, so I think the value in discussing it is to make people aware that what they're experiencing is a real syndrome. So let's define it. So across the range of severity that you could have after COVID, we're not talking about folks that had severe critical COVID complications and were in the hospital, were intubated, had a number of organ dysfunction that then impacted the brain. The curious thing about this is that we're seeing folks who were exposed to COVID, tested COVID positive, had mild illness, meaning they didn't go to the hospital, they didn't have decreased oxygen, some symptoms, but were kept at home, or they were asymptomatic. And then at some point, their body start experiencing fatigue, malaise, feeling run down after exertion, and this thing that we're a very nondescript thing called brain fog, that they're just not processing information quickly. And it scares the hell out of people. And early on, no one knew what it was. But we are seeing so many cases, and it's being reported so often in the literature, and folks can log on, go on the net and log on and find these websites on, COVID, long COVID, what is it, how to get support around it, and more importantly, what to do about it.
And is it a certain period of time? So we know it's not the critically ill patient that got COVID and had brain damage because they were so ill.
Correct.
Just a mild case of COVID. What period of time has to elapse, or are you seeing it elapse before patients kind of start noticing this? Or maybe that you realize that it is really a problem, that now I'm over COVID and I'm still having trouble.
All right. So let's be clear, 85% of folks that have COVID are going to walk away without any problems. right? So we're talking about a small, subsection of folks, but the numbers of COVID have been so large that you're really seeing volumes in the office. So a couple of curious things. One is how folks with mild or asymptomatic illness are going to develop this syndrome, and some folks have a lag between they were COVID positive, now they're negative, they were asymptomatic, and weeks later, this thing, kicks in. So we think it's an inflammatory response that, based on this particular virus, it activates the immune system. Some folks that have really bad illness have this quote unquote, that cytokine storm, that this extremely exaggerated immune response. These folks have mild illness, but the same way the immune system gets turned on, it's got to get turned off, and it never gets turned on. And sometimes it comes in waves. So these folks may have weeks of feeling fine and all of a sudden start feeling run down. And then they think that something's going on because I was asymptomatic when I had COVID. How is it that now I'm feeling fatigued and I can't think straight? And it scares the hell out of them. And a lot of these folks end up having, trouble at work and at school.
Wow.
And we end up seeing them. And now we got to figure out what to do. First, let them know that this is a real syndrome, that this is not fabricated, it's not fictitious. Trying to understand what's going on with it. It's an inflammatory response. The closest that we can get so far has been from the cardiac literature. And 6 months after folks have had COVID, you can, in the heart, continue to see inflammation of cardiac tissue and decrease ejection fraction, right? And that's 6 months afterwards. We think the same thing is probably happening in the brain. There's some low-grade inflammation, and it's just affecting the way the brain is processing things. And the things you're going to see is, fatigue, a sense of feeling run down, especially after exertion, and then this brain fog. If you had loss of smell and taste, that might persist. You might have joint pain as well. But it's a real syndrome. Some comparisons are being drawn to chronic fatigue syndrome, myalgic encephalomyelitis, and to fibromyalgia. Two kind of poorly defined things that we see all the time that are real and that, and that can be persistent.
So of course, a lot of people have had COVID. I had COVID, and I did okay at home and everything else. What percentage of people that have had COVID are going to end up in this long hauler?
So the problem with the prevalence rates is that it's really poorly defined. We know that more women tend to report it. So we don't know if that's actually that more women truly get it or just end up, in the doctor's office. So that gender seems to be a bit of a risk factor. But we don't know the specific percentage because some folks just don't report it.
What about age?
If you're a little older, it tends to hit you a little more. But the second patient I ever saw with long COVID was a young, healthy, collegiate athlete who just couldn't get back to where she was before having COVID.
All right. So somebody is concerned they have this at home and they're listening to us and they've watched our show and what is the first step?
Talk to your doctor, get worked up, make sure that nothing else is going on. We want to get a baseline on you. We're going to do assessment to see where you're functioning cognitively. We're already developing a neuropsychological profile on how these folks look. It's essentially just slowing of certain brain pathways. So come in, get assessed, make sure that's what's going on. What do you do about it?
Yeah, that was my next question. Well, so you're going to go see a doctor. Most primary doctors are not going to know really what to do. So you're going to have to see a psychologist or neuropsychologist, right?
A neuropsychologist, neurology, neuropsychology, come over our way, let us work you up and let us monitor you.
All right. So you're probably going to get an MRI of my brain to see the inflammation, right?
We're probably not going to see it.
That's what I thought, right?
We're probably not going to see it.
Right. This inflammation, and I want to make that clear because we talked about that inflammation. Inflammation in COVID is what really was the detriment of everybody, right? The inflammatory response in the lungs and the heart and all this stuff. But in the lungs, we saw it. I mean, people's lungs looked horrible on X-ray and on CAT scan, but we're not seeing it in the brain.
No, that's why I'm saying it's very subtle, and we're extrapolating from the cardiac literature. There's a very nice article published where the cardiac tissue was still inflamed. We're not picking that up.
So that's why I think it makes your job so difficult. Me, I can get a CAT scan and find out what the problem is. You all the testing will be normal, but now you do other testing, which is what you're going to get into, which is more of the evaluation, putting people through like tests, right?
Correct.
Like cognitive tests,
psychometric, cognitive, intellectual testing, just to see how you're doing and to get a baseline on how you're doing it. And some of these folks have very subtle symptoms, and their workup comes back negative, which is good. Those folks tend to do a little better over time.
Okay.
How long does it take to get back to baseline? We've seen folks at 3 to 6 months. I've seen people that at 2 years that still are not back to where they were.
Wow.
So fortunately, those folks are in the minority. Most folks are getting back, to their pre-morbid baseline.
So we go in, you get the cognitive testing, and you find out that somebody, yes, has long COVID. They're a long hauler. What is the treatment?
So certainly there's no FDA treatment approved for this. And
what are we trying? I mean, what are people, because listen, you and I know this as healthcare professionals, over the last couple of years, there's not like been treatment for COVID. We've been experimenting with COVID, right? So we've tried things along the way, and it's hard for me to explain to my lay public friends, like, they would ask me, do you guys even know what you're doing? I'm like, no, we don't know what we're doing. We're trying things along the way. It's a new disease, right?
We're learning as we go.
So maybe the question is not what is the treatment for long COVID, because we don't know what it is yet, but what are some of the things that are being tried, been successful, maybe even unsuccessful?
Right. So certainly let's do the lifestyle things first. And we're bringing this over from other viral infections that we've had to deal with and from traumatic brain injuries. So get plenty of rest and plenty of hydration. Try to get as much sleep as possible. And folks don't understand how critical getting uninterrupted sleep. So in a way, it's restructuring your life during a stressful period to try to be as stress-free, because we know that's putting a burden on the brain. Don't try to rush back. If you look at the concussion literature, folks that have a concussion and try to get back, and I'm not talking about on the playing field, just back to work or in the classroom, they tend to have a tough time. It's almost exerting the brain without letting it recover. It tends to prolong recovery rate. So at work, take it easy. That's one of the values, is that we've actually talked to employers to validate what your employees going through is legit. So just take it easy, stay away from the toxins. Now's not the time to increase your drinking, marijuana use. That's very deleterious when you're trying to recover from something like this. Minimize alcohol consumption, get rest, hydration, and just try to engage in anything, yoga, meditation, any kind of healthy brain activity is going to be real critical. We think certainly can't harm, but that's what we're recommending to our folks. On the medication side, again, nothing's FDA. I want to be really clear. There's nothing that's FDA approved for this. 4 papers have been published on use of antidepressants during COVID as an anti-inflammatory effect. Really interesting. And there seems to be an anti-inflammatory element to antidepressants. So folks were showing up at the hospital and they were being placed on antidepressants, and they didn't do as poorly as folks that were not. They were not treated with an antidepressants. So we're kind of bringing that over and saying it may help in long COVID. And a lot of these folks are depressed anyway, just because of the pandemic. And we're treating them with an antidepressant in an off-label, not FDA, right. But that repurposing approach is what's being seen with COVID, that drugs that we know have a great safety profile are already available for this illness. Let's try it on. So some of our folks who have been depressed, I think, are getting a little bit of additional benefit from being on antidepressant, because we're seeing them respond well to the antidepressant. But again, but this is after a good workup. I also think that we're going to see less long COVID as more people get vaccinated. I think we're going to just see. So
what about vaccination? I didn't ask you that. What about vaccination status in somebody? Have you seen long COVIDs with?
We've seen, right. Remember, the vaccine doesn't mean you're not going to get it.
Right.
It just means you're going to have decreased severity. Right. So I don't know if we're seeing enough folks yet come through. I think I can't answer that.
Okay, not yet.
And I did have one person an N of one who had long COVID, then got vaccinated and said she got better. Right? I don't know.
Okay.
But we're all learning as we go.
So whether you got vaccinated or not, you could still get long COVID.
You could still get
and
long
we don't know
COVID.
whether a vaccinated individual is less likely to get long COVID.
And that's our hope. That's our hope. And we don't know.
Okay. So I heard about rest, hydration. I heard about things like meditation,
yoga,
right? Avoiding toxins like alcohol and drugs and marijuana and things like that. What about brain exercises? Whether it be a puzzle or
Sudoku, crossword.
Yeah.
Well, all those things are always helpful just for good brain health.
Okay.
But nothing. We don't have any data on that.
Okay.
If you're an athlete, don't rush to get back to the gym. It's important to get back in the gym, but don't push it, because you'll hear folks say that it took me longer. Folks that took some time off and then came back. If you're an athlete and wanted to get back in the gym and get back on the treadmill, you're going to get tired real quick. You're not going to feel well, and it almost prolongs your recovery time. So take it easy getting back to work and getting back into the gym. If you can't take it easy getting back to work. We all got to get back to work. But just again, don't overdo it, and don't be impatient and get frustrated with yourself that you're not able to get back quickly. This is something that's going to take a little bit of time for your subset.
Yeah,
of
and
folks.
even if you go back to work, at least now we have a diagnosis, or we have a syndrome that is recognized that we can help with regard to the employers.
Correct.
And so forth.
Correct.
Now, besides the antidepressants and medications, any other medications?
Nothing. There's I think there's one FDA trial out now looking at antidepressants. I've heard of some folks trying anti-inflammatories for this, but I haven't seen any results from that yet.
Okay. And then, long term, well, I mean, we don't know, but you're an experienced neuropsychologist and you've seen patients, and I'm sure on the first day you see somebody, what's going to happen in 5 weeks and in 5 years and in 10 years. What do you see on the horizon for these individuals? Are they going to recover, or is this going to be a lingering problem in our society?
So we don't know.
I know you don't.
We don't know because we're learning as we go. I think one of the interesting questions is this going to increase the risk of dementia over time? Is this the type of virus? And it happened with after the Spanish flu, that years and decades later, there was an uptick in some neurologic illnesses. We don't know what the answer to that is. Either way, I think it's one of those things that we're just going to have to monitor over time.
Wow.
Folks that we know that already have, older folks tend to have a tough time with this. Folks with dementia and already had some cognitive impairment didn't do as well. And even folks, our geriatric folks that didn't have dementia, that didn't have any cognitive impairment, just that social isolation, I think took a real toll on them, just being away from others and not having the cognitive stimulation.
Wow. So we've learned quite a bit now about this long COVID. I didn't even know, when you told me we want to talk about long COVID, I was like, what is this long COVID thing? And you've explained to us that it's a real entity, a real syndrome. And, of course, getting rest and hydration and getting help, getting a diagnosis from a professional like you is very important. Now, I want to just spend a couple minutes, and I know this is dangerous because talking a couple minutes about dementia is very difficult. But let's, since you mentioned it, and since, it's a topic that's very common, let's just, just for a couple minutes, talk about what is dementia and put it in perspective for our viewers and how it possibly could relate to what's happening with this long COVID.
All right.
So what is dementia?
So it's probably one of the most misunderstood terms. Literally, it means a loss of cognitive ability in excess of what we should be losing. So as we get older, there's going to be cognitive decline anyway. So I sit with, 80-year-olds all the time, and I say, what brings you in? My mind's not, working the way it used to. And I always, I say, you don't go to the orthopod and say, I'm worried because I can't run as fast. I'm an 80-year-old, I can't run as fast. But there's this thinking that my brain should just continue functioning, and it's not. We actually peak out. Our maximum cognitive horsepower. I got to tell you.
Oh no! Don't tell me. Don't tell me.
I got to tell you.
Go.
We're both past. We max out late 30s to early 40s is where we crest. And then it's just a gradual decline. It's normal. We're aware of it. We know what it is. So when you come in to see us, our primary question is, are you losing more ability quicker than you should? So that's what we do. That's what we do.
Well, we don't know that. You know that.
Right. But if you're concerned, come in and see us, because that's our job. Are you losing more ability than you should? And I want to be clear, dementia is not a disease. You know, he was afflicted with dementia. It's not a disease. It's a clinical state. It's like saying someone has a fever. A fever isn't a disease. It's a clinical manifestation. It's a symptom of something. And then our job when you come into the emergency room is to work you up what's causing the fever. Someone's demented, and I can tell you if someone is demented, they've lost cognitive ability quicker than they should have. I got to figure out what's causing it, right? And that's where the workup comes in. Number one leading cause of dementia, Alzheimer's disease. It's going to account for 60 to 70% of all dementia cases. That's why people, I think, use those terms synonymously.
Right, and interchangeably, and it's wrong.
And it's not, because, you know, there are a number of things that can cause you to dement. Alzheimer's is number one. Vascular changes in the brain are another one. You know, Parkinson's, you can get a dementia syndrome. And our job is that whole workup that you do when you come to see us, you know, blood work, you know, brain imaging, neuropsychological assessment, is all trying to figure out what type of, do you have dementia? And if so, what types, so that we can intervene.
So then what in Alzheimer's, how is that? Alzheimer's is a real disease.
Alzheimer's is a real disease.
Okay. And how do they make the diagnosis of Alzheimer's?
So after the workup, if you don't have any on brain imaging, if there's not another process, a vascular process, if you exclude every other, we do labs and all your labs are fine. If we exclude every other process and our neuropsychological assessment shows that you're not thinking, that your memory, your language functions, your attention are below where they should for your age, you're 70-year-old, we're going to compare it to another 70-year-old, and you're not able to do things as well, you're not functioning at the same level, there's a good chance you have Alzheimer's, and we're going to monitor you.
Okay. So if I think that I may have some cognitive decline, or it's a little slower and the attack is not as sharp, is there something that somebody at home can do, check, themselves before going to you and saying, I can't run the 40 in 4 seconds, like I used to,
So I think that now that folks, at home know that a certain amount of decline is to be expected, if it is getting in the way of what you're doing, just come in and get it checked out.
Okay.
Two reasons. One is, if something's going on, we want to catch it early as possible. There's, the treatments that we have, the FDA approved treatments, aren't great, and they work best early on. Mm-hmm. So if something's going on, we're going to catch it. We want to intervene as quickly as possible. But it gives us a nice opportunity to do a good workup and get baseline data. And for us, there's nothing better. Ask a neuroradiologist, he's going to take a look at this brain. Do I have another study? Because if I can compare this brain from the same brain a year ago. So if you come in and we get a workup and we do I get a good neuropsychological study to serve as an objective baseline point, I could see you in a year and I could tell you if there's been decline that we have to worry about. So there's very little downside to coming in and getting these things checked out.
Wow. And so what about being concerned? If my father, my grandfather, my grandmother, my mother had Alzheimer's, am I more likely to get it?
So you're at slightly increased risk if you have a first-degree relative with it. Doesn't mean you're going to get it, but you should be a little bit more attentive to it. Of all the neurologic conditions, it's not the one that carries the greatest, heritability, but you're at elevated risk, so you should get it checked out. Doesn't mean you're going to get it, though. I want to be really, really clear about that. And we see a lot of folks that are there just because they have a family history and they're noticing little things. And we'll work those folks up. And just because you don't have someone in the family doesn't mean you're not going to get it, because you could have these sporadic cases. Yeah. So either way, if you're concerned, there's no downside to getting it checked out.
So how much, I forget things sometimes, and I'm big on lists and writing things down and keeping, and of course I've noticed over the years as I've gotten younger, I've noticed that I'll forget. When should a person be concerned of you're going to be more forgetful as you get older, right?
That's part of normal aging. We call it benign changes associated with aging.
Okay. So when is it? Can you give a rule of thumb of like hey,
maybe when there's a little bit of functional compromise, maybe when you catch yourself making some errors, is probably a good marker that to come in. I'll tell you what, we see a lot of folks, the complaints, I'm always misplacing my car keys. I came out of the falls. I forgot where my car was parked. I'm having a little bit of trouble. God, what was that guy's name? I just saw him the other day. We see those folks all the time, and there's nothing wrong with them. This is part of normal aging, and we're so distracted by things. But I think when it really starts getting in the way, and you're making mistakes at work or at home, something's happened at home. You forgot to pick up your grandkid. That's
you left the kid in the car.
Something like that. Those are big issues. Yeah. So when it starts to really impacting functionality, come in and get it checked.
Can I stop from getting dementia or getting Alzheimer's from having that? Is there any way to prevent it?
So it depends what the underlying disease is. So if it's due to vascular change in the brain, you're having these small vessel changes. If you can control the underlying risk factors, if you control your cholesterol, your blood pressure, watch your toxin intake, there shouldn't be, advancement. If it's Alzheimer's, so those are the two leading causes, vascular change and Alzheimer's. If it's Alzheimer's, it's going to progress. The issue is, how long it's going to take, and no one's got the answer for that because it's quite varied. What I will tell you is that healthy lifestyle, and you were talking about cognitive exercises. We do have good data that folks that remain physically active and healthy, and folks that remain intellectually active and healthy, tend to, if they get it, they're not going to go downhill as quick as folks that are very sedentary, not in great health, and just don't use their brain. So you've got to stay active. Years ago, what cardiologists were telling their patients, all these things, good for the heart, good for the brain, right? Aerobic activity, watch your blood pressure, watch your cholesterol, watch your toxins, no smoking, moderate alcohol consumption, and aerobic activity. And then throw in that one part about being active.
In the brain.
You have to do it.
That's what I've heard.
If you retire, volunteer.
Teach
do something.
Part-time,
Teach.
do something. Yeah.
We have a lot of folks who go to Fairchild Garden and volunteer and learn, get involved in botany and learning the names of the plants, learn a new language, learn an instrument. All those things just make the brain work.
Right. All right. And then what about treatment? You alluded to it a little bit. Is there treatment? Is it good? Is it not good? There's medications for Alzheimer's.
So there are medications, for Alzheimer's. The therapeutic objective is to slow things down. There's no cure for Alzheimer's, and there's nothing to prevent Alzheimer's. You can slow it down. There's some interesting things in clinical trials. The FDA recently released a medication amongst a great deal of controversy, and we're not sure where that's going to play a role. It's a kind of a unique mechanism of action, and I think the jury is still out. And the FDA released it and said, but we still need more data. But the medications are the best available. If I had a family member, I would put them on these medications. We know about them. They're safe, and it's the best we have.
Wow. Incredible. Well, I think we've learned a lot. I've learned a lot for sure about long COVID. Okay. And we've brought awareness about long COVID, and you've clarified this, the dementia and the Alzheimer's for us. So I want to thank you for coming here today. And I think we've, for our viewers, it's been beneficial to, again, understand another health topic, and a topic that I don't, I'm always about more of the physical body, and we talk about the lungs, and we talk about the heart here, and we talk about the the male organs, the female organs, but we don't do a lot of brain, and especially not brain tumors or herniated discs in the spine, the cognitive or the neurological or psychological aspect of the brain. So for me, it's been enlightening to understand that. And I want to thank you for coming.
Pleasure to be here.
All right. So once again, being awareness, I've heard that a healthy lifestyle is important. Again, getting plenty of sleep, drinking a lot of water, exercise, physical exercise, mental exercise. Be aware about long COVID. And if you or your family members have it, and you've understood today, of course, the difference between, dementia and its big umbrella and how there's different types of dementia. So once again, on behalf of Dr. Rivas-Vazquez, Dr. Anthony Gonzalez, again, from Miami Community Health, signing off. Have a great day.